Hello, I'm Dr. John Abebe, the Medical Director of the Abebe Fertility Center. Once again, you're welcome. So we'll be going through the fertility investigations that couples who have just had their registration and had their first consultation to begin their journey to parenthood, what they go through. Now, it's important for us to note that every couple going through fertility care at the Abebe Fertility Center must have a fertility evaluation done through our investigations. Now, we basically have two packages. You have what we call the standard fertility investigation and the basic fertility investigation. Now, the standard fertility investigation is for couples that are going to be stimulated. What I mean is that we are using the eggs of the woman, all right? She's going to be stimulated, and so she goes through the standard. Now, the difference between the standard and the basic is the hormonals, all right? That is why for the standard is for patients who are using their eggs, because they will go through gamuts of hormonal tests just to evaluate their hormonal reserve, the response that is anticipated, and ensure that everything is fine as regards their ovaries, all right? And now the basic fertility investigation is for couples who are going through, who will be using the egg donation, the third party, so they'll be requiring egg donation. Now, basically, the tests that are included in these packages include the seminal fluid analysis for the male, the blood group and genotype for both the male and the female, and also serology test, which is important to exclude any infection, and then the hormonal assay that is done for clients who are using their eggs. I want to also say that there are two hormones that are done for all females, whether you are using your eggs or not, and that is the TSH, that is the thyroid stimulating hormone, and then the prolactin. They are done for all female clients. All right. Now, the client will get the results by mail once the results have been out, have been completed, and what this means is that both the male and the female, both tests have been done. We have situations where the female have completed their test and the male has not yet come. Maybe the husband is not around. We would typically want to have all the tests completed before we have the results sent to you by mail, and thereafter the office will now go ahead to book a result review session with the specialist. Now, a lot of patients have asked us if we can have our tests done outside and send us the results. Unfortunately, we want to have all our tests done at our center so that we can be in control of our tests and we can use them to be able to determine the treatment we are going to be offering. So we usually don't allow tests to be done outside. However, for patients who are not based in the country, we would usually want to have them do a test just to have a preliminary results, but when they come into the country for their program, we will still require them to have their test done. So for patients who are going through the standard fertility investigations, now these tests, they are timed. They are usually done between day 1 and day 3 of the menstrual cycle. So typically what would happen is that the patient will be told that once you see your next period, by the following day, call the office to schedule an appointment to have your test done. And the reason why we have it timed is because of the hormonal tests that are done. A lot of the hormonal tests, particularly the FSH and LH, they are done within the first 3 days of the woman's menstrual cycle. So that is why the woman is asked to come in at that specific time. For the basic fertility investigation, it can be done at any time of the cycle, so that is a bit more flexible. The woman can just call once she's ready, and then she can come in for the basic fertility investigation. It's important to note that the couple can come in together to have their test done, or whoever is available can come in first and they can come in at separate times. Now, for the seminal fluid analysis, we usually would will require a 3 to 5 days abstinence, not more than 7 days abstinence before you come in for that test. And the means by which the sample is collected, the semen is collected, is usually by masturbation. However, for men who have challenge with being able to masturbate, we can provide the other option of using a non-spermicidal condom to collect the sperm. But the preferred method of collection, which is what is also used on the day of the collection of the sample for insemination, is by masturbation. And after the tests have been completed, for the basic fertility investigation, you have a 1-week waiting period. So what that means is that when you have finished your test, both the man and the woman, you have completed your test, in 1 week the results will be ready and the office will call to schedule a result review appointment. And for the standard fertility investigation, it's a 2-week waiting period that would give. Now, after this time lag, if you've not heard anything from the office, please call the front desk to inquire about your results, and then you would be scheduled. Now, after 1 or 2 weeks, you will receive a mail from us of your test result. That is indicative of the fact that your results are ready, and you would now be scheduled for a result review. Every client going through our program must have a result review, because it is very important for you to have that result review, because it guides us as to the treatment options that we'll be presenting before you. In the next video, I'll be talking about the result review and how it is done, the relevance of it, and how to prepare for the result review. So please, I look forward to having you come in for your fertility investigation. Remember, you must book an appointment for this particular phase, the fertility investigation. Don't just walk into the clinic and say, I've come for my fertility investigation. You must call to say that you're coming, and then you make your payment. That the details of that you can get from the front desk when you give them the call. The cost differs whether you are doing a standard fertility investigation or the basic fertility investigation. Once again, look forward to seeing you at our doors. God bless you.